Hey guys, this is my week 2 post regarding borderline personality disorder. I chose option 1 to talk about my personal experience with treating folks suffering from borderline personality disorder. In my professional experience, I've worked both in an ER setting and within the military setting and in a combat zone and outside combat zones. I highly don't recommend treating borderline personality in a combat setting. It's definitely not a healthy therapeutic environment, I would say. Since I've been in the military and working in ERs on a part-time basis, I've treated, I'd say, on and off, great number of patients suffering from borderline personality. A primary treatment method would be dialectical behavioral therapy, using, trying to change their cognitive distortions and their environment, or getting them to have different viewpoints of their environment. I'd say that class study material regarding the best video I liked so far was the one with Frank, having a patient come in suffering from borderline personality disorder and be 5 minutes, the clinician was 5 minutes late. That was spectacular. I'd say that's exactly how it is with folks suffering from borderline personality disorder. They take a lot of things personally, and you have to really work on your boundaries, and you have to have really good skills at fighting off transference and countertransference in the setting. So I'd say the biggest challenging is boundaries, and that's the biggest challenging I faced early on as a clinician. I had one client that after termination tried to come after me and do a lot of negative things that I'd rather not say on here. But 2 weeks later after that, then after it was all over, tried to friend request me on Facebook. So yeah, it can be really, really challenging. Having good coping skills and self-care is really, really important with working with borderlines. And being well-trained with working with folks suffering from borderline personality disorder. I highly recommend DBT, dialectical behavioral therapy. I'm really interested in the one mentioned in the class text. But what do you guys think? Do you guys think that folks suffering from borderline personality disorder really deserve a clinician with really good, healthy boundaries? Obviously, you should have those with all of your clients, and you should never be Facebook friends with your clients. I just want to throw that out there. Not a good idea. Don't do that. My advice is just, I don't think that ever works well. I've seen therapists do that in the past, and I don't think that ever, that's a little too much out there. But what do you guys think? Do you guys think boundaries are important with working with borderlines, folks suffering from borderline personality disorder? Thank you so much. Hope you guys are having a good week. Talk to you soon. Bye.